Hello there, I'm here to deliver your medication and perform a few checks. I can see you're a fan of the old ASMR on the TV there. Have a look in the briefcase here. First I'll sanitise the hands. Okay, let's see what medication we have to deliver. Right, we have 30 tablets, 180 milligram of fexofenadine hydrochloride. Take 2 daily. Have your tub of dihydrocodeine, 60 milligram tablets. Take 1 every 12 hours, please. We have your nasal spray, approximately 150 doses. Your Reflexes there. And we have one more thing here. Your 40 milligram propanolol, 28 tablets in a pack. Take 1 twice daily, or an extra 1 in case of a panic attack, please. And I've also brought with me for you a pill box here, labelled days of the week. You can pop your tablets into those and keep things organised and on the button. Okay, so because you can't get into the surgery, I brought the equipment to you. So first I'm going to check vision, cover your left eye, and read down to the smallest row possible there, please. And cover the other eye, looking at the smallest row you see. Tell me where you see the break in the C, and move across the row. Thank you. So that's at 40 centimetres. And I do believe you are down for cataract surgery in the not too distant future. That should go fine. And usually you have improved sight, colours, improved contrast afterwards. Right, just looking off at the wall, I'm going to use this bright light just to check your pupils. Okay, just look towards me. I'm going to check the pupil sizes here. Look into this eye, please. And this eye. This eye. And this eye. So we have about 4 millimetres each eye. Normal pupil reactions to light. track your eye movements. Okay, keep the head steady and follow this red target at the top of the stick with your eyes. Excellent. In fact, I'll stick with this one. Follow the target towards the nose, please. And now the smaller target at the top. Okay, now look towards my nose. Tell me when the target appears in your side vision. And here we go. Excellent, thank you. So, ocular motility. Convergence. And visual fields using the confrontation method. And red dots. Okay, I'm going to have a listen to your heartbeat. Okay, I would like you just to breathe normally, please. Put it in through the nose and out through the mouth. Take a deep breath in, hold it, and out. A deep breath in, hold it, and out. So that's pretty normal, but your medication does help with that. Thank you. Okay, we're going to do some pulse oximetry. So just give me your hand there, please. And we'll place this finger into the device. Let's just take a moment. Okay, 98 and 82, thank you. Okay, just leave your arms floppy at the side. We'll do some reflexes. side. Excellent. Okay, how have you been feeling recently? Let me check your temperature, please. That's absolutely fine. So pulse oximetry, 82 beats per minute. We had 90 BPM. Normal sounding heart rhythms. Alright. I'd like to take a look inside your mouth. Okay, I'm going to use the tongue depressor, so just open wide, please. Okay, now lift the tongue to the roof of the mouth, please. Okay, tongue to the right side. Tongue to the left side. Okay, relax the tongue flat. Okay, just looking at the soft palate there. And the uvula, just say ah. And again. Okay, and just for your teeth. Okay, no signs of any lesions in the mouth. No signs of any inflammation. Okay, just look off into the distance. Just want to do a cover test. Okay, look towards me, please. To this eye, and this eye, this eye, this eye, pupillary distance. So, mouth examination, clear, no lesions, no signs of any tonsillitis. Cover test distance, orthophoria, and your pupillary distance. Okay, let's have a look at what we have remaining. I think blood pressure is important. Right arm for this, please. Okay, obviously had this before, it's going to be a little bit tight. Just ensure that you don't hold your breath. inflation here. We have 130 over 85, thank you. Not too bad. Okay, I would like to have a look at the level of cataracts that you are having removed at the hospital very soon. Okay, let's go a bit closer and have a look. The level there. So for the right eye, certainly some nuclear sclerosis. It's at least a grade 3. And from the nasal side, grade 3 cortical opacities and crouching the vision. Okay, and the level of cataract in your left eye. I'd say this is a bit more. Cortical wise, NS grade 3. And you have cortical opacities from the nasal and the temporal side. At least a grade 3, starting to encroach. Just have a look at the surface of the cornea to ensure that there's no edema. Certainly have a prominent arcus. That is normal with age. Let me review the right eye cornea. Looking at those cataracts, they're certainly maturing, aren't they? Nuclear sclerosis and cortical opacities. Grade 2 plus, grade 2 plus. Right nasally and left cortical opacities, nasally and temporally. Right, so we try and cover all bases when we're here. Have a look at your bifocal lenses. Okay, now how are these performing for you? Yeah, that's understandable. We have moderate cataracts there. Just a few hairline scratches. I can certainly look at changing your spectacles after surgery. Just going to give your spectacles a little clean. Certainly don't want any deposits. Yeah, just don't want any deposits hampering your sight. These are a nice supra pair. ears are secure, intact. Okay, well, all polished for you. Leave those on the side. And the final thing I'm going to do is have a little look inside your ears. Okay, I'm just going to ask you to turn this way slightly. And just turn to your right. Okay, not looking too bad there. And relax, thank you. So it is time for me to pack up. Not looking too bad at all. Your medication there, your spectacles there. If there are any problems, just give me a call at the surgery and I'll try and come out to you again. Good luck with your cataract surgery and we'll catch up afterwards.